We've talked about sepsis on the channel earlier, where it is a serious condition in which the body responds improperly to an infection. So instead of the body helping you, it's actually killing you. Now this is more than 200,000 cases per year, and it is very common. Not only can it affect a senior, which is most likely, or a kid our age, or even younger kids, it causes 270,000 deaths per year, which is most of people that don't want to die. Three types of infections. First, that can cause it will be fungal infections. Second will be bacterial infections. As you guys can see, these are the four bacterial infections that are commonly to cause this. Pause the screen if you want to read it. Here are viral. This is what viral infections are, so you get a hint of it. So yes, viral infections can also cause it. Most likely to cause sepsis are these, and these are where it's most likely to take place if you were to get sepsis. Sepsis is most commonly found in these places on the screen, including the bloodstream. And these are the people most likely to get sepsis, including people with diabetes and people born prematurely. This is the structures of the human body, which, if you looked earlier, you can see all those places on here are most of the important parts on this body part are going to be infected. So, nobody really wants to die. They definitely don't want to die due to sepsis because it's a long and painful death. Basically, just imagine you are walking down an alleyway and you start to see this one person just stumble while walking into stuff. They're sweating confusedly, just profusely. They're sweating like crazy. They can't talk. They're almost about to pass out. Their legs are shaking. They're breathing heavily. And when you look at them, they start to seem a little bit ill. Which, before that, you could probably already tell that they're ill, but there's something going on. Now, in this part of this video, as this will be breaking it down into parts, we'll be explaining how fast sepsis can occur. So we all know sepsis can occur and develop quickly from initial infection and progress to septic shock in as little as 12 to 24 hours. One, you may have an infection that's not improving, or you could even be sick without realizing it. That's the thing with sepsis and infections, is that not every sepsis or an infection that can cause sepsis can actually go diagnosed. Most of the time, you can think most of the symptoms you're developing or having is actually nothing but a common cold, which is mainly why it kills so many people. So even cases of sepsis that rapidly leading to severe symptoms can occur within hours. For example, in cases of septic shock where the infection overwhelms the body's system, a person may experience a sudden drop in blood pressure and organ failure. With bad blood pressure and organ failure, you're dead. Now, I don't want you to get alarmed with this, as it's pretty hard for sepsis to just come on randomly. You have to have a cluing of some of the infections popping up on your screen here, as we'll be talking about. First, you have to have an infection, like a serious infection, like a fungal infection or a bacterial infection or a viral infection. Any of those three following infections, and any of the infections that fall into those three categories, you must have to develop infections, or sepsis. But that's not always the case, as we're coming up with other random ways you could come up with sepsis without infections. Now, that's why people say when you have wounds or cuts to wash them properly, because if not treated properly, they can become serious pretty quickly. Now, it says cuts and scrapes can happen. A simple wound, if not treated properly, can kill quickly, become a serious health risk. Even small scrapes or cuts can allow germs, including viruses or bacteria, to enter the bloodstream, causing an infection which can lead to sepsis, which, again, can be treated quickly and be prevented by washing your hands thoroughly if you have a cut. Now, in my offense, though, I've always had cuts before. I mean, we've all experienced cuts before. I even cut my hand on a handsaw before, and I washed it thoroughly at the nurse's office at school, and it was okay. But if you don't treat these necessarily in the right properly way of doing it, or proper way, it can lead to death and can kill you, because cuts and bacteria are very, very dangerous if they're mixed together. Cuts are actually pretty prone to infections, as they're already opened up to wounds, as they're already opened up to many bacteria and harmful diseases. So allowing your cut to be open for longer than what it should be is allowing bacteria and viruses that can become very dangerous in an amount of time to access your body and to enter your body through that cut, which then can produce more and more germs and more bacteria of itself into your skin. Now, one way you can tell by that is by redness of the part of the body that is very, 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 very infected. Infected signs, which we'll talk about now. So, one of the ways you can know your wounds are infected are pus. Pus or cloudy fluid is draining from the wound. Pimple, a pimple or yellow crust has formed on the wound. Soft scab, the scab has increased in size. Red area, the increasing redness occurs around the wound. Red streak, more pain, more swelling, and swollen node. Some of these are very, very serious, and we'll be talking about two of which all these symptoms are the most severe and you need to look out for immediately. One being the red streak. If you look up red streak from cut, you will see the lymphangitis, which is a basically a complication to this, which can have a complication of sepsis. So basically, red streaks or lymphangitis often indicate a more serious infection. Seek immediate medical attention if you notice this symptom, as this could mean a telltale sign of catching sepsis. As it could say, usually indicate a spreading infection that can result in sepsis. And it says the red streaks or lines are worrisome as they usually indicate. Now that doesn't mean they will always indicate, but there is a 99% chance that they will always indicate a sign of sepsis. If you log up basically a slip notes from a cut, infection lymphangitis occurs when viruses and bacteria invade the vessels of the lymphatic system, typically through an infected cut or wound. Tender red streaks often indicate from the wound toward the nearest lymph glands. Other symptoms include fever, chills, and a general sense of illness. So, you actually learned a couple things in that part of the video about what lymphangitis is, and basically what causes lymphangitis. So you learned more about that and more. But now in this part, we're going to learn about the complications of lymphangitis. So before we get to that, I want to teach you some more facts about it. So it usually splits the lymphatic system for a primary infection. The infection is usually bacterial but can be fungal or viral. Anyone who have signs of lymphangitis should seek treatment at once. In some cases, not treating the infection can lead to severe complications such as sepsis. Now there are other ones, such as can lymphangitis lead to sepsis. So in less than 24 hours, an infection can spread from the initial wound to several areas of your lymphatic system. Left untreated, the infection can enter your bloodstream and causing sepsis. If you notice red streaks on your skin or other symptoms of lymphangitis, tell a healthcare provider immediately. So it can cause it in less than 24 hours. Is lymphangitis an emergency? Yes, it can be. Lymphangitis can spread within hours, so it's important to see a medical healthcare provider or go to the emergency room as soon as possible. As soon as you notice symptoms, without treatment, life-threatening complications such as sepsis can arise. I got all this information off Google. Again, that's where I get most of my information off of, and this is from real doctors that have made real, research on this stuff too. They basically research their stuff too because they're real doctors, and I got this information off real doctors' websites. Moving on, the symptoms are fever and chills, enlarged and tender lymph nodes, general ill feeling, headache, loss of appetite, muscle aches, red streaks, and throbbing pain. Possible complications are an abscess, collection of pus, cellulitis, and sepsis. So most likely the least dangerous one will be cellulitis, but all three of these can be very, very painful and very, very worrisome. Definitely will cellulitis be, as my mom has had cellulitis before, and I'm glad she's okay. So, now as you know the complications, why these complications can exist, and why you need to get healthcare immediately if you see these symptoms. These symptoms can arise quickly or can come along slowly, and they can be very worrisome. For many reasons to why they're very worrisome is for many, many reasons for all we know for sure is because they can lead to dangerous complications that can cost you your life and your future. So you need to make sure to be careful about what you do and when you do it. Basically, what I mean by that is just be careful about what you do in your life. I want you to live your life, but I also want you to live in caution, as sometimes living in caution like I do, not as good as I do it, but just live in caution as sometimes. And also, if you've ever seen symptoms like these, if you see other people experiencing symptoms of these, and they say something about having lymphangitis, but never got any health care for it, make sure to get them to the emergency room immediately if they have any of the symptoms that we talked about on this video so far. We're getting into the one final part of the video, more information about sepsis, complications, what sepsis can lead to, if it can lead to a lockjaw, or what it's called is tetanus, and much more, which will all be in a 5-minute period. So one thing you need to know about this is just be very, very careful of what you do, because this can come on very, very suddenly. If you do suspect you're coming down with something that could be very life-threatening, it's not just a game of waiting and just seeing what happens, it's a game of whether you should go or not. That's not true. You need to get help immediately, because playing that game of should I go or should I not could cost you your future and your life. So, again, this can all happen mainly because of all the bacteria and all the viruses and illnesses that are inside this lymphangitis can kill you. Because all of the stuff that cause lymphangitis can cause sepsis. Again, because sepsis is a complication of lymphangitis. So lymphangitis is not always something you will get right before sepsis. That's mainly if you get a cut. You can only get that if you've got a cut or a wound that has a red streak going across it. Before we get to the next part, I want to show you some pictures of what you need to look for on your body or on other people's bodies of yours that seems very, very serious. Now, if you have someone that is complaining about a cut, I'm going to show you pictures that could just save your life and others. Because again, this is a very, very serious thing, and I do not want it to claim lives of others. So as you guys can see on the screen, you can see there's a big red streak going down his arm, or on these people's arms. You can see they're going down, not just ending somewhere, but keep on spreading downwards. As you can see, they do have some severe cuts or bruises or bumps that can lead to this. As you can see, it's spreading outward. So those are what they look like. Now, the moment you've all been waiting for. Everything to know about sepsis in 2 minutes. So, some possible complications of sepsis are kidney failure, tissue death of gangrene, of fingers or toes that may require amputation, which means it has to be cut off with anesthesia so you don't feel it. Permanent lung damage from acute respiratory distress syndrome, which can also occur with this whole sepsis complication stuff. So there are other things you need to look out for, such as septic shock, which is the last and most dangerous stage of sepsis. Sepsis can be divided into 3 stages: sepsis, severe sepsis, and septic shock. Sepsis is life-threatening. It happens when your immune system overreacts to an infection. So if basically an infection, we just talked about what sepsis is, it basically happens when bacteria enters the bloodstream. So, sepsis is a serious condition in which the body responds improperly to an infection. The infection-fighting process is turned on the body, causing the organs to work poorly. Sepsis may progress to septic shock. This is a dramatic drop in blood pressure that can damage the lungs and tissues and stuff. So it mainly will affect the kidneys at first. So it will mainly just target the kidneys and will cause the kidneys to shut down first. Colors of urine will be dark red to black. Urine and blood samples, acute homolysis, along with the presence of sepsis include, I don't even know how you pronounce that, maybe the early sign of C. So again, you need to look out for dark red and black urine, which no matter what it is caused by, that is not normal pee and urine color. So antibiotics cannot cure sepsis let alone. So you will also need fluids with antibiotics. The body needs extra fluids to help keep the blood pressure from dropping dangerously low, causing shock. Giving IV fluids allow the healthcare staff to track the amount. Therefore, depends on how ill you are, and the type of help you need will also depend and will tell you how long you need to be in the ICU with this. So you will only be discharged from the ICU when you no longer need a special drugs and machines to support your body, and when you are strong enough to cope on a general unit.